Hello, my name is Hufsa Masood. I'm an undergraduate public health student concentrating in population data science at San Jose State University. And today I will be speaking about employment industries influencing young adults' willingness to get vaccinated. So our research question is young adult vaccine attitudes. Does employment status matter? We wanted to analyze working young adults' attitudes towards COVID-19 vaccination and the relationship between employment sector and vaccine attitudes in young adults. A little bit of background, vaccination is key to ending the COVID-19 pandemic, and employment industry mandates may influence vaccine uptake. The purpose of this research is to explore whether employment industries influence young adults' willingness to get vaccinated. For methods, a cross-sectional study was conducted among young adults ages 18 to 25 in California in October of 2020. The survey assessed employment status, employment sector, and attitudes towards COVID-19 vaccination. For the results, we had over 400 participants in the study. After adjusting for age and employment status, we received 360 responses. Among the 360 young adult respondents, 216 were employed in a range of industries, including healthcare at 22.2%, retail at 16.2%, food and agriculture at 14.4%, education at 18.1%, and other at 29.2%. Attitudes towards vaccination varied, with 22.6% stating they would definitely get the vaccine, 32.7% probably would, 31% stating they probably would not, and 13.7% stating they definitely would not get the vaccine. After testing for an association between employment industry and overall willingness to get the vaccine, the retail industry showed the highest support towards vaccination willingness, while healthcare workers showed the least support in willingness. Results, however, were insignificant, and a chi-squared test showed no association between employment industry and overall willingness to get vaccinated. There were different patterns in the level of willingness by industry, which were interesting findings. For example, healthcare showed a significant favor towards definitely not getting vaccinated, as well as very low responses in favor of definitely or probably getting the vaccine. Retail and education workers showed they were most in favor of probably getting vaccinated, and we can infer vaccine hesitancy may have been higher among employment industries that were prioritized first for the vaccine. Conclusion and why this matters. These data were collected prior to emergency use authorization of 3 COVID-19 vaccines and mass vaccination programs across the country. In California, these programs have distributed vaccines by sector, with healthcare workers being the first offered the vaccine. Young adults in each sector play an important role in ending the pandemic because they are often asymptomatic. Understanding whether attitudes have changed since vaccination became available is critical to ending the pandemic. Studying vaccine distribution, vaccine support among young adults, and employment industry vaccine mandates show a trend of overall governmental and employment industry influence over humanitarian decisions, such as vaccination. It is important and relevant to human rights to recognize how these powerful influences impact individual decisions. Additionally, it is crucial to acknowledge certain racial and economic barriers individuals face in finding opportunities to get vaccinated when living in low-income, underfunded neighborhoods and when unemployed. This work is relevant to social change in its understanding of the privileges employed young adults have in their ability to get vaccinated through employment mandates. I'd like to thank you for taking the time out to listen. I'd also like to acknowledge the authors involved in this work at San Jose State University, the Fall 2020 Epidemiology course for conducting the study, and finally, the Thoracic Foundation for our funding. Thank you.